Randy Riley, a registered nurse and trauma program coordinator, cares for many patients at Essentia Health-Sandstone.
I've been working at Essentia Health for over 30 years now, and I work in the surgery department, in the emergency room. I'm the trauma program coordinator. I just started working in the new infusion center for chemotherapy infusions, so a little bit of everything.
In February of 2018, after many years caring for his patients and neighbors, Randy decided it was time to better care for himself.
I've always been kind of on the heavy side, never really obese, but always pushing it. I lead a very sedentary life, or always have, kind of a couch potato. You know, I have bad legs, so I can't run like I used to, and so I've just slowly kind of picked up weight over the years. Tried Atkins, tried some of those things. They work in the short term, but I just needed to do something different.
Randy saw an email from his colleague advertising the National Diabetes Prevention Program and decided to sign up.
It's a year-long program, and the whole program is focused on lifestyle change. So right away people think diabetes prevention, but really it's just taking the person as a whole and looking at all different aspects of their life, and specifically working on weight loss and then also increasing physical activity to really reduce the risk of diabetes.
One way Essentia is fulfilling its mission to make a healthy difference in people's lives
Now we're going to talk about how to build a healthy meal
is by supporting the national program in our local communities. Success stories like Randy's prompted Essentia to offer the program to employees who have specific Essentia Health insurance plans with free online or in-person options.
It was hard initially. It was very hard. They made us fat detectives. They taught us how to figure out how many fat grams were in different salads and different things, and how to calculate all that stuff, and how to really look at what you're putting in your mouth and figure out your calories and that. I was almost 260 pounds when I started, and right now I'm about 223. And when I finished the class, I was 218. And that was my goal personally, was to kind of get under 220. So I'm still hovering, still working on it.
In addition to losing weight, Randy has also created a more active lifestyle.
I've started walking more for sure. I used to not very much, my legs hurt, but I found the more I walk, I do better. I certainly watch more what I eat, a lot less junk food, although you can have a little bit here and there, but I try to really watch my intake anymore.
We have people that are making lifestyle changes with their physical activity, with their nutrition choices, with their stress management. The program really encourages people to make their own lifestyle changes, which thus impacts the patients, employees, and communities.
I've never been a diabetic, and I don't know, I was probably close to being pre-diabetic, though my A1C numbers were climbing, and they've all come back down to normal. I was heading in the wrong direction, and that really made a difference.
As a result, Randy's healthy lifestyle changes are helping him be a better caregiver.
I'm led by example, and I can talk to my patients that have these problems with prediabetes and say, listen, this is what I went through. I was headed in the same direction you're headed, and this is what I had to do, and it worked, and it's been life-altering.